Welcome back to my channel. Before I begin, I just want to ask you guys to subscribe to my channel, like, share, and comment, please. I would really appreciate that. So, welcome everybody. Today I'm gonna talk about my job that I'm doing, and I just want to help someone who is looking for a course to do. Maybe you're undecided of what to do. I just thought I would share what my job entitles, and you might be interested in doing the course as well, like I did. So I'm an operating theater practitioner. What does that mean? It means I work in theaters. I train to work in theaters. So my job, you can only work in theaters, in hospital, or now you can also work in the community as a mobile operating department practitioner. But the course is called Operating Department Practice. That's the course. Initially, it was a diploma that you do for 2 years, of which that's what I did. And now it's a degree that you have to do, and it's for 3 years. The qualification is the same, the job is the same, it's only that one has got a diploma, the other one has got a degree. So what does an operating department practitioner do? So an operating department practitioner, you are trained to do anesthetics, you are trained to do scrubbing, and you are trained to do recovery of the patient. So you will be trained in all three specialities. And then at the end of it all, some might decide to multi-skill. When I say multi-skill, you can decide to do either the two of the specialties that I've mentioned. So you can either decide to do anesthetics and recovery, or you can decide to do anesthetics and scrubbing, or you can do all three of them. So in case they want an anesthetic practitioner, you are there. In case they want a scrubber, you are there. In case they want a recovery practitioner, because you would have trained in all three. But I personally decided to just specialize in anesthetics. I can still do recovery, I can still do scrubbing, but I think because I haven't done it for a long time, I've lost that skill. But I can still, get it back if I really want to. So this course, it's everywhere. It's in most universities in the UK. So you can apply it through UCAS. And if you have not been in education for too long, for a long time, you have to do an access course first. So you do an access course, you finish your access course, you go into university, you apply through UCAS, you go into university, and you do this course for 3 years degree. It is a good job. Sometimes it can be hectic, sometimes it can be challenging, but overall it is a good job. And most people don't know about operating department practice course. So it's kind of an awareness as well Because even me, when I did the course, initially I wanted to be a nurse, and then I didn't even know about this operating department practice. And then someone said, "Why don't you try that instead of nursing?" And I was like, "What's that all about?" So I looked into it. I researched about it, and I kind of liked what I read about it. And then I just went straight, you know, applied for it, got a place at University of West London, and I did my course for 2 years. But what I can say is 2 years. It's a very short time for this course because there's a lot to do, and I felt like in 2 years it wasn't enough. And most of the things I learnt it on the job, to be honest. So it's kind of an advantage to those who are doing a degree because they've got at least 3 years to do that. And also, it's most of its studies are placements. So about 60% is placement, and 40% it's mostly one-to-one in uni or independent studying. So you'll be in a different hospital where you do your placement. So you'll be doing the job, learning to do the job with a mentor that you'll be with. So you're allocated a mentor in whatever trust that you are going to be in, and then you do your placement there, and your studies until you finish. So it's a good course to do. For those who don't know anything about operating department practice, just Google it and read about it. Read about what you study about, how long it's gonna take, and the careers that you can pursue after finishing the course. So, as an operating department practice, when you qualify, you can either work as an operating department practitioner, like I said, in hospital, in theaters, or you can work in adult day surgery unit. You can also work in ICU as an operating department practitioner. And like I said, nowadays there are these mobile units which are in the community. You can also work there. It's a new thing that is just started. I didn't know about it. You can also be a lecturer if you're an operating department practitioner. You can be a lecturer in university. You can go into teaching. There isn't much in terms of choices, in terms of options when it comes to this job. But you can also do agency work, sign up with an agency, do some agency work. There are jobs all over, there are jobs everywhere, countless, and pays a lot as well. So operating department practitioners, they are not as different with nurses in terms of their pay, because the pay is the same. So a nurse band 5 and then ODP band 5, they get the same pay. So if you want to know about the pay that the operating department practitioner gets, just look at the nurse pay with all the grades, band 5, band 6, band 7, and going up. It's the same thing. So it is a good course to do. If you want to work in healthcare, if you don't want to be a nurse, you can go for operating department practice. If you don't want to be something else in the healthcare, this is an option for you. So I just thought I would talk about it and maybe someone might need to look into it, and go for it. I tell you, you won't be disappointed. I tell you, you will not regret it. It is a good job to do. Like I said, it can be challenging, it can be busy, but overall, it's not that hard to do. Obviously, as you study, you have assignments to do, you have essays to do, you have presentations to do, you have exams to do. So, just like any other course. So, you just have to put in the work and go get what you want. So, me as an anesthetic practitioner, what I do every day is I go in my workplace. By the way, don't forget to subscribe. Go and subscribe, please, as we carry on with this conversation. Subscribe, like, and share. Thank you. So, what I do is we use anesthetic machines to keep our patients alive, to, give them anesthetic agents to keep them breathing, to basically keep them alive. So, these machines, I have to check them every morning. In my workplace, there's an anesthetic room and there's an operating theater. So there's two in each room. So I check anesthetic machines. I check all the drugs that are going to be used. I check controlled drugs. I check all the equipment. Sorry, all the equipment that I'm going to use for the day. I have to have a list of the patients who are on that operating list for the day. So I have to know what cases I'm doing, what operations I'm doing, how many patients I have on that list, so that it helps me to prepare myself. So I check all those things, equipment, drugs, make sure I've got everything. Everything is checked, it's spot on. And then I have to meet with my anesthetist for the day, who I'll be working with. So in other words, I work as an assistant to the anesthetist. So anesthetists cannot work on their own without an ODP like myself. So we work hand in hand. So then they come, they tell me about the patients once they've seen the patients on the ward, if they've got any health issues, if they've got any airway issues, if they've got any allergies, then they tell me then. And then prior to doing the surgery, we all meet as a group, the scrub team, the anesthetic team, the surgeons. We all meet up, we discuss about all the patients that we have for the day. And then we start our day. So I assist with drugs, controlled drugs. I'm the one who has to make sure I've given them to the anesthetist, whatever they require. I sign for them, they sign for them, because these are controlled drugs. They are accountable for. And then I have to assist with the airway. I have to make sure the patient is comfortable. And yeah, so we just look after the patient whilst they are unconscious having their surgery with the help of the anesthetist. Make sure the patient is comfortable, make sure the patient is not in pain, make sure the patient is not aspirating, is not vomiting, their blood pressure is, stable, their heart rate, everything to do with vital signs of a patient. So yeah, so that's what we do. Once that operation is finished, we wake the patient, take them to recovery, then we hand them over to the recovery staff. And then we carry on and do the next and the next and the next until we finish. So it's quite a good and interesting job. because we we see different people, we interact with different people from all different walks of life. We engage in different surgeries. It can be abdominal surgery, it can be breast surgery, it can be colorectal surgery, so many variety of surgeries. So it's quite interesting. And to actually, be able to talk to patients before their surgery, what they do, the history maybe of why they are where they are at that moment in time. So it's quite interesting. So I would recommend that if you are someone who wants to go into healthcare and you don't want the option of going for nursing, this is another option that you can go for. So once again, it's called Operating Department Practice. That's the course that you will do, and it's a degree for 3 years. And once you qualify, you will be called an Operating Department Practitioner, and you work in theaters, in hospitals. So yeah, research about it and read about it. Sorry, read about it, and hopefully you like to try it and you go for it and you enjoy what you are going to come across. So thank you once again for listening. I hope I have helped someone. And if there's anything you want to put in the comments, put it in the comments below. And again, don't forget to subscribe to my channel, please, and like and share this video. It can help someone. You never know. So thank you once again for watching. I love you and God bless you.